Medicines represent a fundamental pillar in the prevention, management, and treatment of diseases, as by acting on the underlying causes and the extent of the symptoms, they significantly contribute to the maintenance and improvement of the patient's general state of health. However, it is important to use medications responsibly and always under medical supervision, respecting the dosages, frequency of intake, and duration of therapy indicated by the doctor. However, this does not always happen, as many people end up abusing drugs as they rely on do-it-yourself, word of mouth, or unverified information found on the internet. This increases the risk of unwanted side effects, of a delay in diagnosis, and of developing a physical or psychological dependence on that medicine, as well as promoting drug resistance. There are some very common medications which are used daily by millions of people, but it is necessary to pay attention to them and always follow the instructions provided by your doctor to ensure safe and effective use. But what are these medications? Let's go see them. Antibiotics. Antibiotic are a category of drugs capable of preventing the development of bacteria, acting through different mechanisms of action. They play a crucial role in the management of bacterial infections and must be used exclusively under medical prescription, scrupulously following the doses, method of intake, and duration of treatment indicated. In the case of non-serious infections caused by bacteria, as the Italian National Institute of Health reminds us, it is not necessary to immediately resort to antibiotics, as our immune system in most cases is able to resolve them independently. Many people, at the first symptoms of flu or cold, think of nipping the problem in the bud by taking any antibiotic available at home. However, these drugs only act on bacteria, so they are useless against viruses, such as those responsible for the common cold and flu. The use of antibiotics for the treatment of diseases caused by infectious agents other than bacteria, such as viruses, fungi, or protozoa, is therefore inappropriate unless an expert identifies a risk that these become complicated due to the overlap of bacterial infections. Taking antibiotics incorrectly exposes you unnecessarily to the risk of side effects, such as intestinal disorders, diarrhea, nausea, and vomiting, abdominal swelling, and pain, as well as allergic reactions. Incorrect use of antibiotics is a real public health problem worldwide, as it is also contributing to dramatically accelerating the phenomenon of antibiotic resistance. It is a natural biological process of adaptation of some microorganisms which develop the ability to survive the same antibiotics that were once capable of defeating them. By becoming more resistant, they make infections more difficult to treat and at the same time increase the risk of complications, mortality, the length of the hospital stay, and costs on the healthcare system. Antacids. Antacid drugs, as the name itself suggests, are a class of drugs used to treat symptoms related to gastroesophageal reflux, as they neutralize the hydrochloric acid present in the stomach, thus giving immediate relief from pain and heartburn. However, the action of antacid drugs is temporary as they limit themselves to counteracting the high acidity of the stomach without intervening on the mechanisms that regulate acid secretion and therefore without resolving the underlying causes. Antacids belong to the category of over-the-counter drugs, meaning they can be purchased without a prescription. While on the one hand, this makes the purchase easier, on the other, it can increase the risk of improper or excessive use. Antacids make the symptoms disappear quickly, giving the illusion of having solved the problem. This can lead to neglecting some pathologies, such as gastritis, ulcers, or tumors, which end up worsening and leading to more serious consequences, with a possible deterioration of gastrointestinal health and an increased risk of complications. Abuse of antacid drugs can lead to a series of side effects, including constipation, diarrhea, stomach cramps, nausea, and vomiting, as well as the appearance of what is called reflex acidity. In this case, An overproduction of hydrochloric acid occurs to compensate for the excessive reduction in acidity that the drugs have caused, further aggravating the heartburn. In summary, despite their effectiveness in relieving symptoms, antacids are not curative, so it is advisable to use them only after obtaining medical advice. Laxatives. Laxatives are drugs which, by stimulating intestinal peristalsis, facilitate the evacuation of feces in a more or less rapid time. There are different categories of laxatives. For example, those that increase the volume of the fecal mass, those that soften and lubricate the feces, and those that draw water into the intestine, carrying out a sort of washing. Laxatives may seem like the fastest and most natural way to clean the intestines and the extreme ease with which they can be purchased in herbalist shops, in pharmacies, and in some supermarkets, all without a medical prescription, makes some people use them improper or excessive use. The abuse of laxatives can have a negative impact on the diversity of the intestinal microbiota, as in the long term, it destroys some of the good bacteria that populate our digestive system. The result is intestinal dysbiosis, which is a condition characterized by an imbalance in the composition and functions of the intestinal bacterial flora, with an excessive growth of bad bacteria within the intestine. Excessive use of these drugs can also lead to the development of a laxative addiction, not for their ability to overcome the blood-brain barrier and act on the central nervous system, but for the desire that arises in those who use them to regulate their intestinal habits, especially if they also suffer from constipation. One of the consequences of laxative abuse is the onset of lazy bowel, a medical condition characterized by a slowdown in intestinal transit, which in turn causes abdominal swelling, cramps, meteorism, and constipation. Therefore, before taking any laxative, always talk to your doctor. He will evaluate which type of laxative could be most suitable for your medical condition. Benzodiazepines. Benzodiazepines are a class of psychotropic drugs that act as central nervous system depressants and are known for their sedative, anxiolytic, and muscle relaxant effects. They are generally prescribed for the treatment of various disorders, in particular for the treatment of anxiety and insomnia, but also of epilepsy and in the management of alcohol withdrawal syndrome. Benzodiazepines are among the most used drugs in the world, but also among those most abused in both adolescence and adulthood. A study conducted by the European School Survey Project on alcohol and other drugs highlighted that 10.5% of adolescents have used psychotropic drugs without a medical prescription in their lives, especially girls. Among the reasons most reported by students for their consumption, we find the improvement of school performance and attention levels, to increase self-esteem, to improve physical appearance, when combined with dietary drugs, and finally to sleep better. Benzodiazepines are not always taken for curative purposes, but also recreationally, a new phenomenon of constantly growing addiction, whose sole objective is to have fun, so much so that they are often combined with alcohol and various drugs to increase their effects. Prolonged use of benzodiazepines can lead to tolerance, physical and psychological dependence, resulting in difficulties in trying to stop taking the drug, as well as a series of more or less serious side effects. These include drowsiness, dizziness, coordination and memory disorders, behavioral disorders, depression, and hallucinations. In conclusion, whether they are over-the-counter drugs or medicines that require a medical prescription, it is important to always take them according to the instructions provided by your doctor or a specialist. Overusing or misusing medications can lead to a variety of complications and side effects that only aggravate symptoms and delay recovery.